The only thing that can stop us from living, playing, and working is not being well. For over 100 years now, we are relying on the public health system to be there when we need it most. As baby boomers are now starting to retire, the cost and demand from our health system is becoming unsustainable. In the developed world, the demand and cost of providing healthcare is growing, and access to services is lagging. In the developing world, they're not spending any money, but don't have access to healthcare. So how can we solve the problem of both worlds? We have to move from reactive to proactive medicine. So can we find technologies that can do this for us? The concept is not new. We've done this in the past. I remember my grandfather back in 1985 getting his first home glucose monitoring kit. And in healthcare, a good solution is one that answers the triple aim. It improves the patient experience and outcome, it improves the health of the population, and it reduces the healthcare cost. And digital health can do all of that. Between our smartphones, apps, devices, wearables, big data, artificial intelligence, we enable to do this in a data-driven way. Physicians are supporting and adopting digital health. Patients will have to start and accept responsibility over their health and take ownership on their body. In the space of digital health, between the apps and devices and wearables, my company, Kesem Health, is falling into the diagnostics and monitoring solutions. We are an Australian innovative medical device company. We've been working really hard in the past 2.5 years, securing funds from investors, getting grants from governments, getting FDA approval, have 3 patents, developing a team, and most importantly, we are developing those clinical evidence which are a must and are required in the field of medicine. I'd like you to think about toilets as a diagnostic tools rather than a waste receptacle, because this is what we do at Kesem Health. We are a weird bunch of people. We are getting excited about urination, and specifically urinary dysfunctions. So issues like frequency, having to go a lot to the toilet, agency, incontinence, nocturia, the need to get up at night to urinate, all of which stop millions of people from playing and working. And those are diseases, and the underlying cause for those symptoms are issues like BPH, benign prostate hyperplasia, affecting 50% of male over 50. Overactive bladder is one of 10 most common chronic conditions in the US. Nocturia has a huge impact and a bill on the economies. So when those patients present to the urologist will sit with them, will take their history, will do a physical exam, and will ask them to do what they call a voiding or a bladder diary. They will also do a uroflowmetric test in the clinic for them. So what are those tests? A bladder diary is a test where a urologist will ask the patient to buy a container, place it over the toilet bowl, and over a period of 24, 48, or 72 hours, urinate into it and write down when they went to the toilet and how much they urinated. Can you imagine yourself having to pee into a container for 3 days? This test is very limited. It has a very low compliance rate. People just forget to do it. Low accuracy, and requires a lot of time and effort. It needs washing, cleaning, writing down results, and then bring it to another consult, maybe 6, 7 weeks later. The other test is the uroflowmetric test. This test is done at the clinic, urologist clinic. The urologist asks the patients to fill the bladder, drink a lot of water. They go into an exam room with a nurse, and the nurse then go, now pee normally. The test measures the flow and stress and strength of urination, but again, in a very limited way. It's time-consuming for both the patients and the health provider. It's not available everywhere, specifically in the developing world. It has high level of false positive, and it's expensive to run. You need equipment, you need a room, you need a nurse, you need the training staff, etc. So what we do, we develop the IUFlow. The IUFlow is a device. It sits on the toilet bowl. It talks to the smartphone, and it collects all this important information about the urinary system. Let me show you a short video how it's done.
Hello, I'm Lisa, and I'd like to show you how to use the IUFlow. I have the IUFlow app installed on a smartphone. I place the IUFlow device on the toilet bowl. I plug the IUFlow device into the smartphone headphone jack and place the phone in a secure location. I then urinate into the device. Wait for the urine to drain. Now I can view and share my bladder diary with my doctor.
Lisa took her phone to the toilet with her to check what's going on with her urinary system. Apparently, every 4 hours, someone tweets that they dropped their phone into the toilet. So with the IUFlow, we give you a real reason why to take it with you. On a more serious note, imagine a world where patients will be able to capture data from wearables, devices, into their smartphones, upload it into the cloud, analyze by machine learning algorithms, compare with other patients like you, and provide insight and actionable data, information that allow patients to manage their diseases directly, directed by physicians. And this is the goal of digital health. We want to improve the healthcare, lower the cost, improve patient outcomes. At Kesem Health, we do it with we. Thank you all for listening, and please stay healthy. Thank you.